Welcome to NeuroCurio. In this series, we explore everyday topics through the lens of neurology. I am Fable, and I establish the subject.
I am Vera, and I report the object.
Today, we will be talking about neurological conditions associated with fire. This is not any type of fire. It is a neural wildfire, a catastrophic bloom of electricity, consuming the forest of the brain and leaving behind a ravaged land. These conditions are hallmarked by a neuroinflammatory cascade, leading to imbalance between excitatory and inhibitory signaling and network hyperexcitability.
First, fires, or febrile infection-related epilepsy syndrome, a rare and devastating subtype of new-onset refractory status epilepticus, NORS that follows a nonspecific febrile illness, typically in previously healthy children and young adults. The acute phase is driven by innate immune dysregulation, with elevated cytokines including interleukin-6, interleukin-1 beta, tumor necrosis factor alpha, and chemokines such as CCL2 and NIP1 alpha. This neuroinflammatory cascade produces superrefractory status epilepticus resistant to multiple anti-seizure medications and anesthetics, often requiring pharmacologic coma. Early initiation of ketogenic diet offers the most promise for seizure control, with immunomodulatory therapies such as steroids, intravenous immunoglobulin, anakinra, and tocilizumab used as adjuncts. Long-term outcomes are poor, with high rates of drug-resistant epilepsy, cognitive impairment, and significant morbidity and mortality. Second, anti-N-methyl-DAS-part 8 receptor encephalitis. Brain on Fire, My Month of Madness is a memoir of Susanna Callahan, a New York Post young journalist's descent into a seemingly psychiatric illness that was eventually diagnosed as anti-NMDA receptor encephalitis. This condition results from B-cell and plasma cell production of autoantibodies against NMDA receptors on GABAergic interneurons, leading to disinhibition of excitatory pathways, increased extracellular glutamate, and network hyperexcitability. Is often triggered by ovarian teratomas or viral infections. Clinically, patients develop early prominent psychiatric symptoms such as psychosis and agitation, cognitive impairment, seizures, dyskinesias, catatonia, and autonomic instability including blood pressure swings, hyperthermia, and hypoventilation. First-line treatment includes high-dose intravenous methylprednisolone and intravenous immunoglobulin for 5 days, with prompt tumor removal when present, and intensive supportive management during the acute phase.
Fire in nature reshapes ecosystems. Fire in the brain reshapes identity, cognition, and survival. The conditions described show how swiftly a neuroinflammatory cascade can transform healthy neural terrain into permanent damage.